PIK3CA mutations are a very common alteration that we see in metastatic hormone receptor positive, HER2 negative breast cancer. And we know that patients with PIK3CA mutations are more likely to have resistance to endocrine therapies and first-line CDK4/6 inhibitors. We've had success previously and have multiple FDA-approved agents that target the PIK3CA system, including inavolisib, capivasertib, and alpelisib. The main problem with targeting the PIK3CA pathway is that most of these inhibitors inhibit both PIK3CA or AKT wild-type receptors. And in doing that, while the drugs have efficacy, they have significant side effect profiles that make them very challenging for patients to tolerate in the clinic. So there is certainly a high need for what we call mutant-specific inhibitors that help spare the normal PIK3CA receptors and help minimize the side effect profiles for patients, because of course we want to improve their outcomes, but we also want them to be on medications that they can tolerate well and live with excellent quality of life. RLY-2608 is the first pan-mutant selective inhibitor with the hope of sparing the wild-type receptor, and it has activity across all PIK3CA mutations. And RLY-2608 has been studied in the ReDiscover first in human phase 1 into expansion platform. And at ASCO 2025, I presented the updated data from the dose expansion of RLY-2608 at the recommended phase 2 dose with SERD fulvestrant in patients with hormone receptor positive, HER2 negative breast cancer that was metastatic and progressive despite treatment with a CDK4/6 inhibitor. We discuss the data, the updated analysis of 64 patients who were treated. About half of them had PIK3CA mutations in the kinase domain. About half of them were non-kinase. About 35% of them were obese or had a hemoglobin A1C in the pre-diabetes range. About 65% of them had measurable disease. 56% of them were treated with one previous line of therapy in the metastatic setting, and about 43% had 2 or more prior lines. All of them had a prior CDK4/6, 40% had prior fulvestrant, and 28% had prior chemotherapy. About 29% of them also had an ESR1 mutation concurrent with their PIK3CA mutation. What we saw in the circulating tumor DNA was that between baseline and cycle 2 day 1, we saw rapid declines in the PIK3CA circulating tumor DNA in almost all patients. We also saw declines in ESR1 mutations in those patients that had concurrent ESR1 mutations. In terms of the efficacy analysis, we saw in the 31 patients evaluable with measurable disease, we saw an overall response rate of 39%. We saw an overall response rate of 67% in patients with kinase domain mutations, and an overall response rate of 40% in patients who already had progression on fulvestrant, indicating probably some monotherapy efficacy. In the overall cohort of patients that had PIK3CA mutations but did not have concurrent AKT or PTEN alterations, 52 patients had a median progression-free survival of 10.3 months. The second-line patients had a median progression-free survival of about 11 months. And interestingly, the patients that had kinase domain mutations had a progression-free survival post-CDK4/6 of 18.4 months, which is quite impressive. Moving along to safety, which is very important, there were very few grade 3 events. There was 50% of patients did have hyperglycemia, but the bulk of it, 31% of that was grade 1, requiring no intervention at all. About 20% of patients required some sort of intervention with metformin. Very few patients required a second, third agent. Only 3% had grade 3 hyperglycemia. We saw some low-grade nausea, fatigue, creatinine increase, some low-grade diarrhea. We saw very little rash or stomatitis, which is differentiating. So overall, we feel like it had, compared to other drugs in the class, quite favorable safety profile. In terms of the clinical benefit rate, about 67% of patients were without disease progression at 6 months, which is quite nice. And this RLY-2608 plus fulvestrant is moving forward in the phase 3 setting, and the pivotal trial will open soon. The trial is including patients who have a PI3Kα mutation, excluding patients who have concurrent AKT or PTEN alterations. Patients have to have progression on prior CDK4/6. So this is a second-line trial. Patients will be randomized to either RLY-2608 plus fulvestrant or capivasertib plus fulvestrant. So going head-to-head in the second line against capivasertib, and it is opening globally very soon. Thank you so much for listening, and have a wonderful day.